Hello, and welcome to the Velocity Made Good podcast. I'm your host, Ted Grisella. I am delighted to introduce today's guest, Dr. Elora Sharmin. Dr. Sharmin is the acting chair and associate professor of pharmacology at Bangladesh Medical University in Dhaka, Bangladesh. Elora was awarded a travel grant to attend the annual meeting of the American Society of Clinical Pharmacology and Therapeutics in Washington, D.C. This program is part of the Society's Low and Middle Income Country Accelerator Program. Welcome, Elora, and thank you for joining.
Thank you, Ted. It's nice to meet you. I'll start from my journey from the beginning, how I am interested in science and mainly in the medical science. It started from the very early of my academic area because in Bangladesh, there is so many population here and most of the time the healthcare challenges faced by these people in this country in very low resource setting. So when I just started my journey in medical training, and then that's time I just realized that the drug safety and the resources for the people, medicine and others availability is very much important for the people of Bangladesh. And the disease that is the non-communicable disease and the infectious disease, tropical disease like tuberculosis, malaria, and they are suffered so much about this disease. So from that time, I started to love the subject that is pharmacology, and I'm thinking that this is the subject through which I can give some things to the people. And this is the way when I started to my journey and interested on the science. And then after when I completed my MBBS, I just do my MD in pharmacology in the Bangladesh Medical University. It is the only one of the medical university in Bangladesh, and it's situated in Dhaka, the center of the Bangladesh. And when I started my post graduation in pharmacology, and just I love the subject because so many diversity in this subject to give the people service like the therapeutic effect and safety of the drugs. How can we make a newer drug through the clinical trial, like the animal trial, to give the potentiality of the drugs to before use the people, and so many like how in clinical pharmacology that is the totally related to the patient. So if we use any drug or anything, what is the impact in between the patients, what's the effect, what's the complication or the side effect, and what the benefit patient are getting from this. So from that time, I just loved the clinical pharmacology and started working on this. So my passion for clinical pharmacology grew through my involvement in various research projects on drug safety, then particularly in tropical medicine, infectious disease, and some chronic disease like osteoarthritis and the diabetics and just some cardiovascular disease, because these diseases are needed to treat from a long term up to their lifelong. So the drug safety and the researches in small resources, how can we improve the health of this type of people is very important. And for this, the clinical pharmacology is the only way so we can give the improvement of the patient safety, treatment outcome. And I believe that to take my decision, specialized in clinical pharmacology, it's very important for me. And next, I will told about you the challenges that I have to face in behalf of the doctor, being a doctor and a clinical pharmacologist of Bangladesh, a low middle income country, and how I overcome them. So I have to face several challenges, particularly in the research area. Because in our context, working in a very low resource setting, and there is biggest challenges is that we have not so many fund and not so many like opportunity, as well as being a woman is very difficult to do a research to establish myself as a researcher in this medical sector, particularly in the subject is pharmacology. Because in Bangladesh, all the people are think that the doctor mainly the medicine, the surgeon, pharmacologist, how they can work with the patient, how can they deal with this type of things. So I have to face so many challenges regarding this, and I make these challenges overcome by the motivational make the motivation to the patient and the also the physician and the educated people and training of the clinician and other healthcare workers, and through my leadership and just conducting them to give my effort, show my effort to doing my hard working. All this helped me to overcome these challenges. And some
So,
people.
Elora, one of the things that you spend a lot of time on is developing the pharmacovigilance infrastructure in Bangladesh. And I
Yes.
thought that was really interesting. And I was wondering if you could just talk about that for a little bit.
In our country, there is only a National Pharmacovigilance Center, that is DGDA, but no other center or no other sub-center in Bangladesh. And as the pharmacovigilance mainly related with the physician, pharmacist, and the patient, this consumer is the main hub for this system. So in my university, it's about 52 specialized department and about daily 1,500 patient flow every day. So I just working on this, establishing a pharmacovigilance center in this university, and for that I make educational module, train the all the sectors of physician, postgraduate student, pharmacist, as well as I also train up the dispenser who are dispensing the medicine in Bangladesh in the pharmacy. So after this training, I just make a new form for it's easy for the consumer, so they can easily report the adverse drug reaction, because in my country only one card, that is yellow card, that's only for the healthcare professional. It's not easy to fill up by the consumer. So I introduced a new form, that is side effect from consumer, in their language, that is Bangla. So they can easily fill up this, and it's friendly for the consumer. As well as I also make a mobile apps. It's just linked with the PhysiBase and the consumer form as well as the healthcare professional form. So when anyone want to sign as a consumer, the Bangla form will come and the consumer can easily fill up the form. And if any physician want to report for the consumer or for the patient, they can sign up as a healthcare, then the yellow card will come. And any physician wants to know that this drug effect is for this medicine or other, or any other country have this type of side effect reported or not. So easily there is a link to go to the PhysiBase, that is published by the WHO after collecting all the data from all this country, and it's sent to the Uppsala. After that, they published it through the PhysiBase. I just make like a mobile apps, but due to some funding problem, and it's the Google Play Store recently, they are just give so many bars to publish any health related product. I am trying for this, and I already emailed them to help me to publish these mobile apps, and it will help the people of our country a lot.
Can you talk about some specific instances of adverse events that have been picked up as part of your work?
Yes, recently one of my colleague called me that when he has some known problem for the drug ciprofloxacin, and so for this he just took the drug and get the adverse effect, and he called me to how he will overcome this. I just told him that you just stop the drug, and after 2 and 3 days you call me again, or I will follow up what happened. And during my journey, so many adverse drug reaction that patient don't know that it is the effect from the drug. As well as the doctors of Bangladesh, they are very scared to report, because they think if they will report, then everyone think that this occurred due to the prescription or drug given by that doctor. I have to motivate them that this is not the matter. If you will report, then patient will benefit it. So it's very much challenges for me to convince all the sector of people to reporting is very important for the patient.
So you recently attended the clinical pharmacology meeting in Washington, D.C., and I was curious about what you thought about that meeting. What were some of your favorite sessions, and what kinds of things did you take away from that meeting?
Thank you. Actually, the SSCPT is it's a very, it's a one of my important landmark of my career because I meet with you as a state. You are very nice people and you give me so much time to mentoring me, and I learn a lot of from you as a mentor, as well as when I reach in Washington DC, the program is very much knowledgeable and innovative, and the talk with the scientist is it's very learning for me, and every session of this meeting is very learning for me, like the dosing schedule, how we could dose the schedule make it for the patient, and then the session for clinical trial in different country, how they just doing their clinical trial. I get so many knowledges from that, and there is a different type of adult people and pediatric people, how they maintain the clinical pharmacology, and in the other low middle income country people also share their knowledge. So it's make me it's a huge knowledge for me I gather from this meeting, and it's helped me a lot. After backing from this conference, I just share my knowledge with my student and my colleagues, and how they make the conference, and there is different slot for the communicate and collaborating with other people and talking with the scientists to exchange their views, their research idea, and the different type of poster in different section of pharmacology, like pharmacokinetics, pharmacodynamics, pharmacogenetics. It's a huge learning for me.
That's excellent. I'm really glad to learn that you enjoyed the meeting and you got a lot out of it, and importantly, are able to take it back to your students and the other faculty. What do you wish that the membership of the society knew about the challenges of being a clinical pharmacologist in Bangladesh?
It's a huge challenge because still now in Bangladesh, all the sector of doctors like the pharmacologist as well as the other professional doctor like medicine surgery, still now in Bangladesh clinical pharmacology, this term is not established still now. Because in Bangladesh, the doctor society thinks that pharmacologist, mainly the pharmacologist, they will teach, they will research, and that's all. But clinical pharmacologist, another platform, and the this platform is working as a team with the others, clinician and pharmacologist, to treat a patient for better treatment and their benefit. So I am just trying to make the people immunity about the clinical pharmacology. Still now, I am working on this.
What do you wish that the society could do more to further your career in research and teaching?
This society, through this society, I learned some lot of things. I will started to just explode on that, and I also just through my student and my colleague, I discuss with them, and I just share my knowledge with them, as well as it's helped me to strengthening my international collaboration, because there are so many people I meet with them, and there I just exchange our research idea, our like platform, website, so many things. So after coming back, I email so many collaborator to do research, as well as I just learn how to make funding and grant support from anyone as a collaborator, because it's not easy to collect the grant and fund for me, as well as also for them to providing me. So it's a long process, and when they will think and they will know that this funding and this grant will support the people as well as also benefited the collaborator also, only that time they will funding us. So I am working on this, so they will make confident on our research work or research idea, then it's easy for us to get the funding and the grant support. And as well as this training make my capacity of on the training program, how to train the other people, how to exchange the research idea. It's also I learned from that, because all the research idea is not working. So which idea I have to share, which I have to just know the people. And another is the mentorship. I take a supporting mentorship from this SCPT. And before this mentorship, I never get this type of mentorship in my life. And I am so much glad to for this SCPT that they give me this type of supporting on mentorship, because I learn how to mentor and how to feel for this their mentee. It's one of learning for me. So it's also helped me in my professional development, and as well as I learned so many research tool and how to you make the data, and so many limitation also in this research field from all the sector and all these countries and all this society. It's another learning for me for this meeting.
Excellent. Excellent. Is there anything else that you'd like to share with us today?
I am very grateful to you because you are one of my best mentor. Just what I say, I always remember you and the meeting people, their warm hospitality. It's so very much, and you know, my picture is on the SHCPT website. It's like shining me, and it's also make me very much smiling that my picture on this website. And another things, I just want to say that's the as so many societies are different platform, so I want to say that this platform make only for the pharmacologist or related the people who are working on this, because if we make this society for all the people, then the pharmacologist platform will be less. So let's open only for the pharmacologists like pharmacy, those working on this field, then it will give more opportunity for that society. Thank you.
Well, thank you for your time today, Elora. I appreciate you coming on and explaining about what you do and the value of attending the annual meeting. And I look forward to talking with you again in the future. Thank you.
Thank you.